Finally tonight, voters across the country will not only choose candidates on Tuesday, but also consider major policy changes in their states. In South Dakota, voters will decide whether to expand government-funded health coverage for some of the state's most vulnerable people. Rogin has more.
The Affordable Care Act gave states the option to expand Medicaid, which covers low-income people and people with disabilities. 38 states and the District of Columbia have done so, changing the income threshold for eligibility so that more people can enroll. South Dakota is one of 12 states which hasn't expanded Medicaid, but on Tuesday, residents there will vote on whether to change that. My colleague Laura Santhanam just returned from a reporting trip there and joins me now. Laura, thank you so much. What does it mean for South Dakota to potentially be expanding Medicaid?
For years, since the Affordable Care Act went into place, South Dakota in a lot of ways was kind of frozen in time with respect to access and affordability to health care. So if the state's voters decide to change that, to expand Medicaid, what it means is that a lot of people will be able to access health care, won't have to worry about being stuck with big bills that they can't afford, and a lot of health issues that otherwise could become catastrophic, much costlier, more complicated to treat, can be caught sooner.
Approximately how many South Dakotans would this affect?
Right, in the first year, approximately 42,000 South Dakotans would be eligible for Medicaid.
And so Election Day is just a couple days away. You just spent a couple days in the state. What's the political atmosphere like there right now?
According to some of the latest polling that we've seen, about half of South Dakota voters are in support of Medicaid expansion. And then about a quarter of South Dakotans hadn't made up their mind at that point. Another 18%, largely Republicans, were opposed to Medicaid expansion.
And one of the things you picked up on was the Medicaid coverage gap. That's where people can't get on Medicaid, but they can't afford private insurance because they make too much money to be on Medicaid and not enough to afford private insurance. That seems like it's a particularly big issue in South Dakota.
That's exactly right. What that means is that a lot of people who work in, frontline or essential workers, like at hospitals, gas stations, grocery stores, they make too much to qualify for Medicaid, but they don't make enough to be able to afford health insurance themselves. And so what that means is that a lot of people, thousands of South Dakotans, are in a position where they have to choose between, fear of financial ruin or gambling with their health. And a lot of them, we're seeing devastating effects, and those are a lot of the stories that I've been hearing.
And South Dakotans of color seem to be even more affected, even though 80% of the state is white. Why is that?
A history of racial and ethnic disparities in healthcare is true across much of the country, and South Dakota is no exception. Looking at forced assimilation, particularly with indigenous populations in the state, that's had negative impacts with respect to access to healthcare. Looking also at food insecurity, housing insecurity, all of those have massive ripple effects when it comes to communities of color being able to access the healthcare they need when they need it. And again, it puts people in a position where they choose between paying this medical bill or getting food on the table.
And pregnant women also seem to be particularly vulnerable here. You spoke to a lot of them. What are they feeling? What are they going through right now?
There were several women who I talked to who made too much to qualify for Medicaid but still couldn't afford their medical bills. One woman, her application for Medicaid was rejected. She was crossing all the T's and dotting all the I's, but then a medical emergency happened when she was 37 weeks pregnant, and she ended up having to be medevaced from a hospital on Pine Ridge Reservation back to Rapid City, and then received a bill for $5,000. And that was something that was devastating for her when she initially got the bill. I mean, she's like, there's no way I can afford that. And so you layer all of those sorts of complications on top of the normal stress of being pregnant, making a home for a new child, and it just makes life very difficult for people who are trying their best.
Laura, there is a way that pregnant women can get Medicaid coverage during their pregnancy and a little bit beyond. There are a lot of exceptions, and it only, though, lasts 60 days. The Biden administration has urged all states to extend it to a full year, and so far 36 states have extended that coverage, but South Dakota obviously has not. What's the argument for extending it?
A lot of the issues that healthcare providers and patients told me about when I was there in South Dakota is that, especially with pregnant and postpartum people, is consistent access to care, both before pregnancy, during pregnancy, and afterwards, right? And anyone who's delivered a child knows that Oftentimes one's body has not finished healing, on a clock, right? 60 days often is not enough time. And so what I was hearing from providers is that, they would have patients who are, trying to schedule surgeries, appointments, things like that while they still had Medicaid coverage, and oftentimes the clock would just run out on them.
It's going to be a very interesting election day in South Dakota. Laura Santhanam, thank you so much for your time.
Thank you for having me.
And we should point out that Laura's reporting was produced as part of a project for the USC Annenberg Center for Health Journalism's 2022 National Fellowship.